Good afternoon, everybody, and thank you very much for coming. I've just chaired a meeting of the Government's Emergency Committee, including ministers from Scotland, Wales and Northern Ireland, and it's clear that coronavirus COVID-19 continues and will continue to spread across the world and our country over the next few months. We've done what can be done to contain this disease, and this has brought us valuable time, but it's now a global pandemic, and the number of cases will rise sharply. Indeed, the true number of cases is higher, perhaps much higher than the number of cases we have so far confirmed with tests. And I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous and it's going to spread further. And I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time. And the Chief Scientific Advisor will set out the best information we have on that in a moment. But as we've said over the last few weeks, we have a clear plan that we are now working through. And we're now getting on to the next phase in that plan, because this is now not just an attempt to contain the disease as far as possible, but to delay its spread and thereby minimize the suffering. If we delay the peak even by a few weeks, then our NHS will be in a stronger state as the weather improves and fewer people suffer from normal respiratory diseases, more beds are available, and we'll have more time for medical research. We can also act to stretch the peak of the disease over a longer period so that our society is better able to cope. The Chief Medical Officer will set out our lines of defence. We have to deploy these at the right time to maximise their effect. The most important task will be to protect our elderly and most vulnerable people during the peak weeks when there is the maximum risk of exposure to the disease and when the NHS will be under the most pressure. So the most dangerous period is not now, but some weeks away, depending on how fast it spreads. Today, therefore, we're moving forward with our plan. From tomorrow, if you have coronavirus symptoms, however mild, either a new continuous cough or a high temperature, then you should stay at home for at least 7 days to protect others and help slow the spread of the disease. We advise all those over 70 with serious medical conditions against going on cruises, and we advise against international school trips. At some point in the next few weeks, we are likely to go further, and if someone in a household has those symptoms, we will be asking everyone in that household to stay at home. We're not introducing this measure yet for reasons Sir Patrick will explain, but I want to signal now that this is coming down the track. We are considering the question of banning major public events such as sporting fixtures. And the scientific advice, as we've said over the last couple of weeks, is that this banning such events will have little effect on the spread. But there is also the issue of the burden that such events can place on public services. So we're discussing these issues with colleagues in all parts of the United Kingdom, and we'll have more to say shortly about the timing of further action in that respect. At all stages, we have been guided by the science, and we will do the right thing at the right time. We are not, repeat not, closing schools now. The scientific advice is that this could do more harm than good at this time, but of course, we're keeping this under review, and this, again, may change as the disease spreads. Schools should only close if they are specifically advised to do so, and that remains our advice. There is no escaping the reality that these measures will cause severe disruption across our country for many months. The best scientific advice is that this will help us slow the disease and save lives. There will be detailed information available on the NHS website and from 111 online. But I want to stress something that's very important in the wake of what we're saying this afternoon. I urge people who think, in view of what we're saying about their potential symptoms, that they should stay at home. I urge them not to call 111, but to use the internet for information if they can. I also want, at this stage, to speak directly to older people, because this disease is particularly dangerous for you, for older people, even though the vast majority of older people will experience a mild to moderate illness. I know that many people will be very worried. And I think we should all be thinking about our elderly relatives, the more vulnerable members of our family, our neighbours, and everything we can do to protect them over the next few months. We're going to need to mobilise millions of people to help and support each other. And I just want you to know that the government will do all we can to help you and your family during this period. We're not just going to be, as you saw yesterday, supporting the economy during this period. We will be providing money and many other forms of support and helping communities to support each other. And as we've done over the last few weeks, we will continue to provide, as soon as we have it, as much clear scientific and medical information as we can. So I'd like to end by repeating the two important messages with which you will become familiar. It is still vital, perhaps more vital than ever, that we remember to wash our hands. And lastly, of course, even if things seem tough now, just to remember that we will get through this. This country will get through this epidemic, just as it has got through many tougher experiences before, if we look out for each other and commit wholeheartedly to a full national effort. And I'd now like to thank, I'd like to ask Sir Patrick Vallance, our chief. I'd like to thank him for everything he's doing, but I'd like to thank Sir Patrick Vallance, our chief scientific advisor, to set out the latest facts and the state of play as he sees it.
So this is a new disease, and none of us has immunity to it, as the Prime Minister has said, and that's a key part of what we're looking at here. It is entering a new phase. The WHO has called this a global pandemic, and we're entering a delay phase. It's important to recognise that the contain phase of case identification and isolation has had an effect to delay things up until now, and currently we're on a trajectory that looks as though it's about 4 weeks or so behind Italy and some other countries in Europe. That means that we've now reached a stage when, of the epidemic that I just wanted to show you on a slide, if it will appear. Here we go. This is the shape of an epidemic. So you go along the bottom for some time with not very much happening, and that's probably where we are now. There are currently 590 cases that have been identified in the UK, and there are more than 20 patients on intensive care units. If you calculate what that really means in terms of the total number, it's much more likely that we've got somewhere between 5,000 and 10,000 people infected at the moment. We've identified 590. The same sorts of ratios will be true in other countries depending on how much testing they've done. That's still a relatively small number. We're still on the flat part. As these curves start to take off, as more people get it, they take off quite steeply. And that's why timing is so important. Because what you want to do is to protect people during the most infectious period, and I'll explain that in just a minute. So we're in a period now where we've got some, but it hasn't yet taken off. The actions that we need to take are to try to do two things. It's to delay, hopefully this will come on, it is to delay the peak and to push the peak down. So we're trying to reduce the number of cases at any one time. That's very important for NHS in order to make the NHS able to cope with this. And it's also important because it pushes it out into summer months where the NHS is less busy, but also where there may be less transmission of virus. Respiratory infections in general tend to be a bit less common. So that's one aim, is to change the shape of this. And it's important to recognise it's not to stop everybody getting it. You can't do that. It's not possible to stop everybody getting it. And it's also actually not desirable because you want some immunity in the population. We need to have immunity to protect ourselves from this in the future. The second big aim that we need to look for is how in that we protect the vulnerable and the elderly, who are at most risk of serious illness and dying from this. And the way this disease looks as though it appears is that you have 5 days or so of mild viral illness, and then a small proportion of people get a second phase where they have some sort of immune response to it, which causes the damage. And the elderly and the sick are much more likely to get that. So during the period of peak transmission, we need to protect them at that phase. And if you look at the curves, it becomes obvious that if you do that at the moment, you're not protecting anybody, really, because the number of cases are too small. If you do it at the right time, then you're protecting them over the peak, and you're not asking them to be in isolation for too long. Similarly, with the idea of households going into complete isolation, that comes a bit later, when you've got some more cases coming up. At the moment, if you asked households to completely isolate if one person was ill, most people would not have coronavirus. You may have to do the whole thing all over again. And what happens then is the effect of that wanes, because people get fed up with doing this and you end up with not being able to do it time and time again. So the timing is critical, and that's true across all of the interventions we've looked at. That's why this is a package of things that need to happen at the right time and in the right phasing. In terms of mass gatherings and schools, it's true that there's some effect in closing schools, but that effect is minimal, and actually you'd have to do it for 13 to 16 weeks or longer, and you don't need to be a very advanced mathematician to work out that the chances of keeping children not speaking to each other or playing with each other over 13 to 16 weeks is 0. And therefore you have to be very careful to make sure you take the right measures that will stop this, rather than things which might end up with children, for example, going to stay with grandparents at a time when they might be most vulnerable. So the idea is to do things at the right time, not to end up with measures stopping during the peak and exposing more people to illness. And I'll hand over to the Chief Medical Officer to explain in more detail the measures that are being proposed.
So I'll just amplify just a few of the points that have just been made. First of all, we are clearly now stopping the contain phase of this operation that we've always said from the beginning. There were 4 stages to this: contain, delay, research and mitigate, and the contain finishes from today. Fantastic work has been done by my colleagues in the NHS and in public health across all 4 nations, and as a result of that, finding the early cases as they were reported, isolating them with the consent of the people involved, for which we are very grateful, and following the chains of transmission, that has helped to slow down the seeding of this virus and has pushed it out in time. So the delay has already begun as a result of the work of our colleagues and the public spiritedness of people who came forward for testing. But now we move on to the next phase, and I think that's made very clear by the fact that the World Health Organization yesterday declared this as a global pandemic, and today the 4 UK CMOs agree that we should raise the risks to the UK, all 4 nations, too high. Now, in terms of what can people do to make sure that we have the smallest impact from this epidemic, that is possible. And we need to do the right things at the right time. And just to add one point to the reasons that Sir Patrick has just given, if people go too early, they become very fatigued. This is going to be a long haul. It is very important we do not start things in advance of need. There are several things we will need to do in due course, which it is not appropriate to do at this stage. I'll come on to one of them at the end. Now, the things we can do now, we cannot emphasize too much the point about washing hands. That is actually an incredibly powerful public health intervention. But the new things from today are to ask anybody who has a cough that is continuous and new, or a temperature, for those who choose to measure their temperature, 37.8. Some people will do it just based on the fact that they have a temperature in terms of feeling. We wish those people to stay at home for 7 days. Now, the reason for this, and I wanted to be clear about this, because we are asking people to do something which will interfere with their lives and interfere with their work and their social life in quite a significant way. So it's important people understand why this is going to help the national effort to combat this virus. The first thing is that it helps to protect older and more vulnerable people who they might come directly or indirectly into contact with. The second thing is, as Patrick has pointed out, this helps to reduce the peak of the epidemic so that it is a lower peak, making it easier for the NHS and health services in all 4 nations to cope as this goes through. The third thing is that it can lead to increased delay, pushing it further into the area where the NHS is under less pressure and giving us more time to get our countermeasures as optimal as possible. I finally just wanted to make a point about why it's 7 days. The virus seems to have its maximum transmission around the time of the first symptoms and for 2 or 3 days afterwards, and then rapidly declines so that by 7 days, the great majority of people are not infectious, and it is fine for them to go back into society. Now, you may ask, why are we asking people with minor symptoms to do this? And the answer is the evidence would appear to be that some people with really quite mild symptoms can spread this virus to a lot of people. So people with minor symptoms should stay at home for 7 days. Now, there is an additional point I want to re-emphasize from the Prime Minister, which is just as people would not normally, if they had a minor sprain or other minor problem, call for an ambulance, it is important that people with very minor symptoms do not call 111. However, if their symptoms start to deteriorate and they're getting to the point where they normally would have sought medical care, at that point we would want them to call 111 or behave as they normally would have done. So we're not expecting people to stay at home as they gradually deteriorate. If there's a certain point people are really worried, at that point they should call the service. But doing it routinely with minor symptoms is not a useful thing to do for them, and it will put a big burden on the service, making it harder for others to get through with what may be life-threatening conditions. There are a few other changes that are going to go alongside this. The first of which is it is no longer needed for us to identify every case, and we will move from having testing mainly done in homes and outpatients and walk-in centres to a situation where people who are who are remaining at home do not need testing, and we will pivot all of the testing capacity to identifying people in hospitals who have got symptoms, so we can pick them up early, make sure we treat them well, and ensure that they don't pass on the virus to other people in hospitals. So there'll be a change in the hospital and other testing systems. And finally, we will no longer have any geographical limits to who gets tested. The testing will be based on symptoms and severity. So it's no longer relevant where someone has come from. This is going to be people irrespective of their travel history. I wanted just to make 2 points in addition to that. The first one is the next stage along, we are going to want to do a package of things which are about putting social distancing around the people who are vulnerable, who are older people and those with severe health conditions. But we do not think it is appropriate to make a national recommendation for that at the moment. because this is too early in the course of the epidemic that Sir Patrick passed on. And if you think about what would happen if you prematurely put elderly or vulnerable people in a situation where you're saying, we really want to cut down on your social interactions, we really want to cut back on every kind of thing where you might come into contact with others, it has big practical implications for them, and it may lead to loneliness and other issues which are clearly very undesirable for them. So whilst we will need to move to that stage, we do not think this is the right moment along the pandemic to do so, but that point will come. Finally, are we in mitigation phase? The answer is this is the stage we need to do the things we can to mitigate, which means to reduce the pressure on the NHS and other health services. And that is basically made up of two parts. The first part is reducing the peak so that the demand on the service is reduced, and that is what the interventions we're talking about today with people staying at home will help to do. And the second part is to increase the capacity and flexibility of the NHS so that it is better able to meet the very considerable demands that are going to be heading its way when we reach the peak of this epidemic.